right, so the physician has put in an order to remove the Foley catheter. So you want to first go ahead and reconcile the order with the MAR, make sure it matches up correctly. You want to gather all your supplies right here. And then you're going to go ahead and head towards the patient's room, knock on the door. Just place this by the bedside. You want to introduce yourself and identify the patient in 2 ways. Also check in with the identification band, making sure that it matches up. Perfect. And then I'm going to go ahead and instruct or educate the client on what I'm going to do today, that I'm going to remove it and obtain their consent. I'm going to perform hand hygiene, as well as put on gloves. It's a lot harder when you have hand sanitizer on your hand. Alright. After that's done, you want to go ahead and put the bed up in working position. Just going to move this a little bit. Before you actually get into the removal of the catheter, you're gonna go ahead and assess the urine bag. You're just gonna assess for the amount of urine that's in there, the color and the clarity. You're gonna then drain it just by pulling that. Drain it into anything really, a specimen cup or anything. All right, I'm gonna go ahead and put the side rolls down. I'm gonna start off by putting a blanket over her to maintain privacy. Just ask her to hold up the top, keep it in place. Then I'm going to go ahead and position her into the dorsal recumbent position, making sure that her feet are 2 feet apart. There we go. Just give her a little, I'm gonna put a linen down, a pad linen, just in case there's any dribbles going on. You want to go ahead and remove the tape. Throw it away. All right. I'm gonna bring this over. And at this part, I'm just gonna grab my syringe, and this is when I'm gonna deflate the balloon. Just gonna go ahead and pull it if it wants to stay in. And right there, it should go out. Just let the patient know that she's gonna feel a huge relief when taking it out. Just comes right on out, perfect. And you wanna automatically go into the pad so that the client does not see the tubing at all. Sometimes they freak out a little bit. Remain privacy. You want to go ahead and check the area, look at the tubing, making sure that, the tip is all good, there's no break off. You want to look for any erythema, ecchymosis, edema, anything like that, making sure it's all clean. Position her comfortably. Just go ahead and remove all this and throw it in the trash if you can get it off the bed frame. This is going in the trash. It's in the trash, all right? You're just gonna go ahead, cover the patient, remove this blanket, put this in the folder or in the little bag. You also wanted to put the side rails up. You want to put the bed in lowest position and the call bell is in reach. Instruct the patient that if she does want to get up and go to the bathroom, that she does need to let us know. We want to gather, she's going to void into a bed pan or a bed hat into the toilet, and we're going to go ahead and assess the urine. So just make sure to call us when she does need to get up and go to the bathroom. Instruct that we will be back in a little bit just to check on her, and that is the completion of the removal.